Our team develops and supports software for the School of Medicine's medical education program. We're responsible for new features and applications, such as the recently launched learning management system. One thing we struggled with on previous projects was unrelated features breaking or not performing as expected after new features were released. Our process was to release fixes along with new features in large batches, about 1 to 2 times a month. We found that we were spending more time fixing bugs than building new features, but we didn't have a way to measure this. Also, we weren't providing visibility to stakeholders into the work that was being done. New features often involve a lot of time and effort to build, and stakeholders don't see this initial effort, they just see the end result. Working with my colleague, Kim Holman, from Project Management and Continuous Improvement, we tried to figure out how we could better define success and show visibility. We were able to start collecting data that would provide insight into our work and guide process improvement. We put the data into a dashboard to provide transparency into the work that was being done, and from these insights, we made several changes. We started releasing smaller batches of fixes and new features more frequently, which decreased the amount of time it took from the initial request to the release. We also implemented an automated testing process to test both new and existing features. Developers still have to write code for the automated testing to work, which requires more time up front, but it ultimately saves time on the back end by preventing bugs from happening in the first place. It also allows us to spend more time developing the features that students and faculty want. Since we started implementing these improvements in the learning management system, we're releasing new features and changes an average of 1 to 2 times per week instead of 1 to 2 times per month. And the rate that these new features are not working as expected or are negatively impacting other features is less than 1%. Because of these improvements, faculty and students are being provided with a better experience, which ultimately benefits the waiting patient.